Hi everyone, welcome to a tour of the new Wolters Kluwer clinical shells in Blackboard. I will be using Nursing 2459 LL Mental and Behavioral Health Nursing Clinical as the example course today, but all of the clinical courses will have many of the standardized forms and look and feel that we'll be looking at today. Each course will have a faculty guide. There's a brief welcome statement that welcomes you to the course and tells you about the important resources to familiarize yourself with. There is a wonderful pre-quarter course setup checklist available to faculty in all the clinical shells. This provides information about how to review and prepare for your course, how to set up your Blackboard shell, a little bit of information about evaluation due date guidelines, and then how to set up that welcome announcement for the first week of the quarter. This file can be downloaded and printed out for future use, or you can just reference it here. The next tab that we'll go to is the School of Nursing Faculty Development Guide. This is a wonderful guide that is linked directly here in Blackboard and will take you to the Faculty Development Guide. This is a great resource if you're looking for more development as a new faculty member or perhaps an experienced faculty member. All of the Wolters Kluwer training and resources are uploaded on here. There are accreditation resources, CRCJ information, but the most important one for our clinical shells are the clinical resources. There is a clinical orientation PowerPoint and recording here for new faculty members. There are also various assessment forms, concept maps, resources for clinical instructors. So again, this is a great site to reference and look at if you have not seen this yet. So back in Blackboard, under the School of Nursing Faculty Development Guide, we have each course's clinical evaluation loaded in here. We have the clinical core objectives, and then we have information about the evaluation process and instructions for clinical, for both formative, clinical formative, simulation formative, and clinical summative evaluation. I want to just mention here under the simulation resources, there are resources that are linked here that will take you directly out to the faculty development guide. This covers new training for simulation faculty who are new to simulation, as well as a orientation checklist and training links as well. So going back to Blackboard, next we'll go to our course lesson plans. Each clinical course will have a clinical lesson plan uploaded as well as the correlating didactic lesson plan. We felt that this was important to include so clinical faculty were aware of what the students were learning in the didactic courses, because that can really drive what skills and activities are done in simulation or in the clinical setting. On the clinical lesson plan, I'm going to just zoom in a little bit on this. These should mirror what the didactic lesson plans look like. It includes the resources that are available and then the assessments within the course. It does have the main clinical course objectives and the course clinical objectives as well, correlating to those. And then there is a blurb here. On each of the clinical lesson plans, you will see the scenarios that are outlined in the National Simulation Curriculum. All of these scenarios have been mapped to the didactic and skills courses, and we've identified the ideal weeks to facilitate these simulations. I want to just mention that due to logistics and scheduling and resources, that is not always possible, but we wanted to call that out here, that if you see a simulation in a specific module, that is the recommended module that scenario is done, but it doesn't mean it has to happen in that scenario, in that module. So coming down to the actual lesson plan here, Each of the simulation scenarios in the national curriculum, their names will be bolded, and then we've correlated them to the ideal module that would take place. We have preparation for simulation activities here. These are straight from the NLN and Laerdal Medical and Wolters Kluwer. So before students come to take care of Andrew Davis, this is what their preparation for simulation should look like. Whether you have the students do this during their pre-briefing or students are looking at this before they come to take care for Andrew, these are some pre-briefing ideas and resources that students can look at. In your pre-briefing, again, you're going to be using that CRCJ tool. That is unchanged from previous quarters. We want to continue to use that. And then students will go and take care of Andrew Davis. This is allotted 5 hours in the National Simulation Curriculum, and this is the scenario name. There are also additional activities noted on the lesson plan, and we'll go into a little bit more detail, but faculty can select activities from these packets that are appropriate for the time and appropriate for their students. And then, of course, after each scenario, there will be a debriefing where you'll use those best practices and the CRCJ tool. So each lesson plan will look a little different based on what scenarios are in the National Sim curriculum that correlate to that case. Next, we'll go down to standardized clinical forms. I encourage you to look around in this standardized clinical form area. This has a great library of standardized forms that can be used, things like an hourly rounding checklist for students to use. And again, all of these resources can be used in residential clinical and in simulation clinical. And we would love to see those forms that are being used in the residential clinical setting also be used in the simulation setting, so the students can really get into that mindset of taking care of patients, whether it's a simulated environment or the true clinical environment at their residential clinicals. There are things in here like medication tables, directly from Wolters Kluwer, and then SBAR worksheets for students to have and work on and really collect a good SBAR. So please take a look around in here, get familiar with the standardized forms. We won't go into all of them during this training. All of the forms are standard across the board for all clinical courses. The one form I do want to call out is the student clinical assignment form. This form should be used in residential clinical by faculty members when they're bringing students to the unit. This gives an idea of the students that are present and what patient room and nurse those students may be assigned to, and then the target skills that you want the students to focus on. There's also an area that focuses on pre-conference topics. Sorry, I'll zoom in a little bit there. Pre-conference topics, post-conference topics, and then what is the student focus? So again, this form should be downloaded and printed off. Feel free to print off many copies at the beginning of the quarter so you're set up for success. And this should be a handwritten document used at clinical to communicate where the students are assigned to. And as the faculty member, this will be a collaboration with the unit leadership team, charge nurse, manager, whoever's going to help you make those assignments for your students. Once this form is written on and complete during the clinical day, faculty should be taking that completed student clinical assignment form and uploading it into Blackboard under the clinical documents section. So under clinical documents, there is a video on how to upload a file into Blackboard Ultra. This video is 1 minute long and really guides you through the steps on how to do that. The next area I want to take you to, I'm going to skip the virtual simulation portion for right now, and I'm going to draw your attention to the student section now. So there is a getting started area for students that just has a brief introduction. This just tells them where to go as far as the course syllabus, the course calendar, and clinical evaluation tabs to learn more about their evaluation. There's a quarterly expectations and policy review. This was rolled out by the School of Nursing Clinical Council over the summer of 2024, but we made it official in all the clinical courses moving forward. This is an assignment that is worth 0 points, but students should be acknowledging that they received the School of Nursing undergraduate handbook, and we also linked them directly to the handbook within the Blackboard course. And they should be reviewing this document here around quarterly expectations. And again, the policy review goes through those key things that we just want to reset on for every quarter, including attendance, appropriate lines of communication, the grading policy, privacy and HIPAA, professionalism, accountability, and the civility code of conduct. Students then simply copy and paste this acknowledgement here and sign or type their name. They'll have to type it in, and then they will submit that as an assignment. We also included the Student Simulation Center expectations here, and students will click on that document and it will link them out to those expectations for simulation. Next, we'll go to the clinical resources and forms. This is just the visible area to students. These are the same forms that are uploaded in the faculty section. So students can print those off, they can download them and use them for future use, and again, print those off. Next are the Wolters Kluwer clinical resources. So there are links directing students out to Lippincott DocuCare, which will be used in simulation scenarios and can also be used at residential clinical if the students do not have access to the EHR at the clinical site. There are training recordings on DocuCare that I highly recommend you check out. But Katie Holt is the subject matter expert on DocuCare at Rasmussen, and she can always take questions as well. There are student resources here. There are basic training videos on DocuCare for students, and then scavenger hunts and tips. I highly recommend you check out the scavenger hunts for students. This is a great way to get students a little bit more comfortable in the DocuCare system. There is an advanced scavenger hunt as well for, perhaps students who have used this for maybe a quarter or two and you want to really get them into the system. And there's also a best practice tips and tricks for students. There are also Lippincott client cases for clinical judgment in these shells. So students will click on this and be linked out to those client cases. And there's also Lippincott Advisor. These resources are also uploaded in the didactic shells. We just wanted to make sure that they were captured in the clinical shells. The clinical evaluations have not changed from the previous shells. We have a blank clinical evaluation uploaded here that students can reference, and the instructions have stayed the same from the old clinical shells. We do have clinical formative, simulation formative, and summative evaluations sectioned out, so it's clear to students where to go for what evaluation. Next, you'll see some of the patients that we saw on the clinical lesson plan. I want to call this out for just a moment. So each patient in the National Simulation curriculum will have its own folder. Within that folder, there will be a preparation for sim and then an additional activities option. Under the preparation for sim, these are the same things that were on that lesson plan, but visible to students. So they know to go to this area if they are coming to the sim lab for Andrew Davis, and they are going to be asked to look at these requirements to prep for their simulation. So again, they'll be going to that Lippincott Advisor or their didactic course resources to look at those references here to prep for Andrew Davis. Under additional activities, for example, an additional activity for Andrew Davis is this DocuCare active learning packet. So students can use this. I recommend that if you are going to use additional activities to look at what is in this form and see what you want to use for your specific group of students. There's a lot of detail and you may not have time to do everything, but this certainly gives a roadmap of some things that you could use. When we were looking under additional activities optional, this is the student version of the packet. And then you will see here, this is hidden from students, but this is the instructor guide to that specific packet for Andrew Davis. So if you are choosing to use it, The answer guide and kind of instruction manual is here for those ready-to-use activities. I highly recommend you take a look. Other things that I'd like to call out here is that for each simulation, it will have its own folder here. Some of the additional activities that are optional for students are the VSIMs that correlate to these patients. I do recommend that you take a look at what VSIMs are available throughout the course. If these are an option, they will be listed underneath the patient. So Sandra Littlefield, under additional activities, there's a client case that students can complete, or there's a VSIM. So if you choose to do the VSIM as an additional activity, you would have students simply go here and then complete all of the portions of the VSIM or the sections of VSIM that you would like them to complete. If you'd like them to do the client case, they would simply go up to the Wolters Kluwer Clinical Resources and click on the Lippincott client cases for clinical judgment, and then they would find that patient that was listed out in the additional activity. So they would load the client cases in a new window, and they would go find the patient that was outlined in the additional activities, which is Chandler Harris. And then this gives the unit that that patient is located on once they're into the client cases. So those are all the modules within the clinical shell. Towards the bottom, we have the end of term survey that will be unchanged from previous quarters. So this will look the same. And then we put the student evaluation of the clinical site at the bottom of this to increase response rates. This right now is categorized as a test within Blackboard. This is unchanged from previous clinical shells. We did keep this the same for right now. In future quarters, this might look different, but for now, we kept this the same. We would ask that students complete this to evaluate our clinical sites for accreditation purposes and best practice purposes. So that's the tour of the clinical shell. If you have any questions, please reach out to me at kate.lindley@rasmussen.edu. I'm happy to answer any questions along the way, but I really look forward to having you all in our clinical shells and using the wonderful resources that are available to us.